Hello, and welcome to our presentation. The news article that we're examining today is titled, How the Fentanyl Crisis Fourth Wave Has Hit Every Corner of the U.S. Fentanyl is a highly addictive synthetic opioid that can be prescribed to treat severe pain. It's 50 times more powerful than heroin, and it's become a common street drug. It's frequently mixed into other drugs, which can create a high risk for overdose. This is dangerous because people can be unknowingly taking fentanyl without having an understanding of its proper dosages. And since fentanyl is so powerful, even a small dosage can become fatal. In addition, fentanyl is highly addictive, which means that if you don't die from taking fentanyl, you can develop a serious dependence on it. And this is a rapidly growing problem. In 2010, in the US, fewer than 40,000 people died from drug overdoses, and less than 10% of those deaths were related to fentanyl. Just 11 years later, in 2021, over 100,000 people died from drug overdoses, with over 66% of those deaths being related to fentanyl. This issue affects nearly every part of Canada and the United States, including both rural and urban communities, as well as affecting people across various ethnic demographics.
The first article we're discussing is by James and Jordan 2018, titled The Opioid Crisis in Black Communities. This paper focuses specifically on how Black Americans are now facing a sharp rise in overdose deaths, particularly from fentanyl-laced cocaine rather than prescription opioids. The paper demonstrates that this shift is most visible in urban centers such as Chicago, Detroit, and Baltimore, where Black communities are experiencing higher than ever overdose rates. For example, in Chicago, Black residents make up about 32% of the population, but account for more than half of the opioid-related deaths. In West Virginia, the death rate for Black residents reaches 35.8 per 100,000 compared to the 23.9 per 100,000 among white residents. This pattern is similarly seen across the country, where in many regions Black overdose rates are now equal to or higher than those of white populations. The article also argues that these statistics reflect systemic racial inequities, as harm reduction and treatment programs are often underfunded or inaccessible in Black neighborhoods, while criminalization remains harsher, with substance use more likely to be punished than treated medically. The authors also note that the national response to the opioid epidemic only shifted towards compassionate treatment once it began affecting white middle-class Americans. Before that, when addiction primarily impacted Black communities, it was largely treated as a criminal justice issue and not as a public health emergency. For nurses, this article is an important reminder that fentanyl abuse is not a medical problem, it's also a social justice issue. Nursing professionals must work to recognize racial disparities, build trust, and advocate for equitable access to care in all communities impacted by the crisis.
The opioid crisis has been a major issue in the United States, and Tennessee has been hit hard. It began as an overuse of prescribed pain medication, but now has branched into more potent and deadly substances such as fentanyl and heroin. Because fentanyl is so powerful, a small amount would be able to cause an overdose. In Tennessee, the deaths caused by fentanyl rose from just over 100 in 2015 to more than 3,000 in 2020. According to the article, it outlines how nurses are entrusted with reducing opioid-related deaths. Since drug abuse involves every aspect of healthcare, it is important that every nurse is familiar with symptoms of opioid addiction and has knowledge on what to do during an overdose, and still provides safe and effective pain management. Nurses are seen as educators, advocates, and caregivers who can identify at-risk patients and guide them to interventions and recovery. The article also talks about the importance of person-centered pain management. The majority of people who suffer from addiction first receive pain medication from their healthcare provider. Because nurses are the ones who dispense these medications and instruct patients on how to use them, they are also in a strong position to prevent misuse and promote safe pain management strategies. Another key point is that nurses can use a tool such as the SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment. This allows nurses to identify patients who may be addicted and connect them to services like detox programs, counseling, medication-assisted treatment. The opioid crisis does not need to continue. Nurses play a pivotal role in ending the rising deaths from opioids, but to do that, they must be educated and prepared to treat those with potential or active substance disorder.
Hi, today I'm going to be talking about the philosophical approach, the opioid crisis in Black communities. That critical social theory as the philosophical approach focuses on how power, race, and inequity shape society. The authors observe that the opioid epidemic is a manifestation of systemic racism in the criminal justice system, the media, and the healthcare system, and also a medical or behavioral issue. The phenomenological approach focuses on the lived experience of Black communities experiencing the opioid crisis. phenomenological encourages the readers to understand the opioid crisis through the eyes of the most affected, therefore creating a sense of kindness, empathy, and better understanding of their world. The value of nurses during the opioid crisis is a critical social theory. Nurses are educators, advocates, and caregivers who prevent addiction, and also encourages empathy, compassion, and person-centered care. The phenomenological approach emphasizes the subjective experiences and emotions involved in nursing practice during the crisis, encouraging readers to comprehend addiction and care from a deeply personal view, empathic, and perspective. Thank you.
Cultural considerations. The fentanyl crisis has affected every community in the U.S., but the impact on Black Americans has been severe. According to James and Jordan 2018, Black individuals are increasingly dying from fentanyl-laced cocaine, which has become more common in cities like Chicago. Black residents represent only 32% of the Chicago population, yet account for nearly half of all opioid-related deaths. This shows that the opioid epidemic is not only a medical issue, but reflects systemic racial inequities. Racial bias in healthcare worsened the problem. White opioid users are often treated as victims needing help, while Black users are more likely to be criminalized and denied equal access to treatment. Only about 60% of U.S. counties have addiction treatment facilities that accept Medicaid, limiting resources for low-income and minority populations, especially in already under-resourced areas. Restricting access to care leads to more substance use, therefore increasing death rates. Haskell and Perry 2022 emphasized that nurses should be trained to recognize signs of opioid misuse without judgment and understand how cultural context influences patient behavior. Nurses must advocate for unbiased access to screening, brief intervention, and referral to treatment programs, and know local resources like medication-assisted treatment clinics and counseling centers. Nurses can provide culturally competent care through awareness, building trust, and advocating for inclusive prevention and recovery programs.
It is crucial to also recognize social considerations, as social issues create and uphold systemic barriers, specifically the untold experiences of Black and low-income communities within the opioid crisis. Recent news about the crisis in America has been primarily centered around the white and wealthier, ignoring the surge of substance use disorders and overdoses in other populations. Watts Pearsons enlightens us on the dangers of being excluded from social discourse. Deaths being overlooked and marketing campaigns that exclude Black Americans cause a lack of awareness within communities, blinding them to the rise of fentanyl-laced street drugs, which lead to opioid dependencies and overdoses. Attitudes towards addiction are influenced by race and class. America's past with SUDs must be acknowledged to understand where we are today and what systemic barriers are still at play. James and Jordan share that when the crisis surrounded Black Americans, they were shown sympathy rather than the empathy we see now. Drug laws were in place, blame was focused on the user as opposed to doctors' prescribing practices. They were seen as dangers to society who could only be saved through incarceration, instead of victims of a disease who must be rehabilitated. The efforts of the government have been in favor of certain populations during this crisis, causing an inequitable access to healthcare, and this can be revealed through the emancipatory way of knowing.
As it was described in the BBC article, the opioid crisis now entered its fourth wave, which indicates how rapidly and seriously this crisis is developing. Nursing implications should include nurses being properly educated and having ongoing training on opioid overdoses by responding with the correct treatment like naloxone and aspirin, and being educated in recognizing the signs and symptoms of possible overdoses, allowing nurses to educate patients and family about certain safe practices and prevention, helping to reduce future harm. Opioid Crisis in Black Communities article really highlights how they have been impacted by not receiving the same and less care with unequal access to the same resources that others have due to stigmas and systematic racism. Implication would be to provide non-judgmental and culturally safe care by ensuring that all patients are treated equally and with fairness, making patients feel respected and supported during these times. The value of nurses during the opioid crisis article brings to light that nurses are not only caregivers, but they're leaders and advocates. Nurses can advocate for more equitable availability for various resources and treatments, which can then minimize negative health and influence health policies to make resources and treatments more available in underserved communities. Nurses cannot let the image around substance use affect or interfere with their quality of care that they provide, ensuring that all patients are getting equitable and compassionate care, along with advocating for those most affected. By doing this, it creates access to the care that they deserve, making the patients feel heard, valued, and respected.